Well, welcome everybody. This is the UKRD Annual Summit 2021, the second year on the trot that we've had an annual summit. My name is Nav Ahluwalia. I'm the Executive Medical Director of the Rotherham, Doncaster and Southumber NHS Foundation Trust and its Director of Research. And it brings me great pleasure to have a conversation today with Professor Michael West, CBE. Now, if you don't know Michael, I'll introduce him very briefly and then we'll have a conversation about one of his major passions, which is compassion in leadership. So Michael was given the CBE for innovation in healthcare and compassion. That's the most important part of that gong that he was awarded that I think we should focus on. He's a professor of psychology in organisational psychology at Lancaster University and a senior visiting fellow at the King's Fund. He's got decades of experience in leadership, and most recently, this year, he's written a book on compassionate leadership. So that's what we're going to be focusing on today, compassionate leadership. So Michael, you're very welcome and thank you very much for giving up your time for us today.
Thank you, Nav. It's a pleasure to be here with you.
So Michael, I'm going to start with what might be perhaps the most obvious thing, which is compassionate leadership. What do you mean by compassion in compassionate leadership?
We have three emotional regulation systems, fundamentally, we human beings. One is focused on threat, so that we feel afraid, we run away, we fight, whatever. Another is focused on goal acquisition. And the third is focused on nurturing, or compassion, if you like. And it has four behavioural elements. So if I'm going to be compassionate towards somebody who's in pain, then I have to attend, understand, empathise and help. And attending means two things. It means being present with and me giving my cognitive attention, my emotional attention as well, if you like. Nancy Klein uses a lovely phrase, listening with fascination, which I think captures it beautifully. And second, I have to understand the causes of the person's distress or pain, ideally through having a dialogue with them rather than me simply imposing my understanding. And third is, I have an empathic response. I feel the other's pain without being overwhelmed by it, because that gives me the motivation for the fourth element of compassion, which is helping or serving the other person. And neuroscience studies over the last 20 years have given us a much clearer picture of the difference between empathy alone and compassion, which has that additional helping component. So when we're empathic, when we ask people to be empathic towards somebody in pain, that's associated with the activation of various pain centres in the brain. But when we ask people to be compassionate, that's associated with the activation of reward centres in the brain. And that makes sense because 99% of us are hardwired by evolution to be compassionate to others in pain or distress. Because compassion, in evolutionary terms, is a way that we build a sense of connection, build a sense of safety, we build social groups like families and wider social groups, and build that sense of belonging which is so fundamental to us. Because, we're as likely to die from the effects of loneliness as we are from, say, the effects of smoking. So compassion is hardwired into us, and it's a core response that we have to our social environment and is just fundamentally important, as we've seen during the pandemic, of course.
So when you've described then how it might be hardwired into the individual, I was reading something from one of your papers which talked about the fact that you believe that it's almost hardwired into the NHS. And the quote here I've got is, an expression in 1948, the NHS was established as an expression of a core national value of compassion. In other words, it was hardwired into the NHS. Could you link the hardwiring from the individual into the hardwiring for the NHS?
Well, in a sense, those who are attracted to work in healthcare, I think, are people who have a very strong sense of compassion. It's a really important value to them. People who are attracted to caring professions, I think, are people who have a strong emotional regulation system characterized by compassion. So that's 1.4 million people who work in healthcare. If you take social care as well, we're talking well over 3 million. And so, if you like, that's the genetic makeup of the NHS, regardless what it says about values in the Constitution. The genetic makeup of the NHS is all of those people who constitute the NHS, the people who work in healthcare. And because they have such a strong value of compassion, I think it's hardwired in, as it were. But it's also the case that the founding values of certainly the welfare state generally, and the NHS in particular, was a founding value of providing high quality care to everyone who needed it, regardless of their background, their wealth, their prestige, their skin colour. And in that sense too, I think that the value of compassion is written in, if you like, to the culture of the National Health Service.
So that's a really neat link between the two. And just thinking then about some of the difficulties we have in that national institution, the NHS. So some of the major concerns we have about our staff are things to do with recruitment, retention, absenteeism, people leaving prematurely or retiring. And you've asserted that compassion should be a central component of the way that we manage those issues. Could you explain that for us?
Yeah, so the culture of an organisation it's not like a piece of pizza or a round of pizza. So we've got this aspect of the culture focuses on patients. Then we've got another slice, which is the focus on the staff. Culture is more like an ocean, and the way we behave in all our interactions in our teams and organisations shapes the culture of the organisation. So if the core value and the core purpose of the NHS is to provide high quality, compassionate care for patients and service users, we also have to ensure that we're providing high quality and compassionate support for staff. And that we're clearly failing to do. So back in January in 2020, we were facing the biggest workforce crisis we'd ever faced in the NHS, with very high levels of staff vacancies, over 100,000 staff vacancies, an even greater number in social care. Very high levels of intention to quit amongst doctors, amongst nurses, amongst midwives, amongst all groups of staff. 1 in 4 nurses were leaving the NHS within 3 years of joining the service. And we saw very high levels of stress. In fact, those levels of stress had been increasing over the previous 5 years steadily, such that in the 2019 National Staff Survey, 40% of staff reported being unwell as a result of work stress during the previous year. So these indicators, vacancies, high levels of intention to quit, high levels of staff turnover, failure to retain staff, high levels of stress, are all key indicators of pathology in an organisation, in any sector. And then, of course, the pandemic came along like a tidal wave with associated increases in work demands. Staff were already suffering from chronic excessive workloads. And then the pandemic came along, and also the inevitable, the natural fears staff had for their own lives, the lives of their loved ones, the lives of the patients and service users they were providing care for. And we've continued to see negative effects of the pandemic. The latest pulse surveys from NHS England and NHS Improvement indicate steadily declining levels of staff engagement and satisfaction with leadership. So this is a crisis of leadership because we are failing to provide the compassionate care and support that staff need in order to provide compassionate care and support for patients. And it's simply unsustainable. And all of the evidence is that when we care for staff, when we provide them with support, that impacts on care quality, patient satisfaction in the acute sector, avoidable patient mortality. So compassion for staff is as fundamental as compassion for patients.
So I find that very convincing. I'm sure many of our audience will find that very convincing as well, Michael. But what happens if we have some people who are still a little bit worried about this concept of compassion? And forgive me, they might refer to it as a namby-pamby woke concept. Some of them might say, for example, will this just make me a bit of a fake? Will this make me seem like I'm dishing out hamburgers in a well-known traditional hamburger outlet? What's your response to that?
Well, you make 2 points. The first is it something soft and fluffy. On the contrary, I think it requires a great deal more courage and authenticity to be a compassionate leader than the rather easy opt-out of command and control. In command and control, I can tell people what to do. Compassionate leadership requires that I listen to those I lead. With fascination, I seek to understand the challenges they face. Remember what I said about levels of staff stress. I am emotionally intelligent and empathise with them, and then I take action to help them to do their jobs more effectively. And that requires a great deal more courage and openness and honesty, I think, than command and control leadership. And we know that those 4 leadership behaviours, when they are practiced by leaders collectively in an organisation, whether we look from data in the retail sector or from the extensive data we have in the NHS from the National Staff Survey, that when leaders behave in this way generally, that predicts staff satisfaction, which predicts patient satisfaction. When leaders don't behave in these 4 ways, then that has an impact on staff experiencing excessive workloads, on levels of stress, which in turn over time predicts worse care quality, worse trust financial performance, higher levels of staff turnover, lower levels of patient satisfaction, and as I said, in the acute sector, higher levels of avoidable patient mortality. So for all of these reasons, compassionate leadership is core. Now, the second question is to do with faking this. Well, you may be able to fake saying, "Have a good day, sir," or "Madam," in the McDonald's outlet, but
other chains are also available. I just need to emphasise.
Other chains are also available, but to truly listen and to demonstrate understanding and to really mirror another person's pain, and then to take action which makes a positive difference, is a much more complex, integrated set of behaviours that are not easily faked. And also they constitute a set of behaviours that, as I said, are hardwired. They're a natural part of who we are. They're not something you need to fake. On the contrary, it's not some new skill that you need to learn. It's about remembering to be present with others, letting go of all of the, if you like, flotsam and jetsam of our anxieties and planning for the future and our ruminations about the past, and just truly being present with the other here and now, in order that we can listen and understand and empathise and then take action to help people do their jobs more effectively by helping to remove obstacles and by helping to ensure they have the resources they need, the right numbers of staff with the right skills, the right equipment, the right technologies, the right training, and so on. So it's a natural way of being, not some skill that we have to learn to do. And it's also the case that people really are hardwired as well to read faking in another's behaviour. But in short, it's a complex set of behaviours that's quite natural to us, and is a very long way away from the kind of superficial laminated politeness and civility you see in the kind of outlets that you describe now.
So my second question was going to be about productivity and performance, but you've said that you believe that it will lead to better health and social care outcomes for our patients if we show compassionate leadership. So let's just take that as a given and move on to my final one, which is it seems to me that it's about authenticity and honesty. But what about concerns from colleagues who might say, if we're honest with people, Michael, if we're honest with them about how they are with each other, how they are to themselves, how they are when they work as part of a team, will that not just lead to accusations of bullying and favoritism from some?
Well, compassionate leadership is an orientation. Compassion's an orientation. Compassionate leadership's an orientation. It's an orientation that's based, if you like, in a commitment to help others, to serve others, which we know is not only good for others, but it's good for us. So all of the research shows us that when clinicians show compassion to those in their care, for example, GPs or nurses over a 2-week period in randomized controlled trials, that has a positive impact on their own well-being as well. So compassion is an orientation to all others, and our compassion in the health service is ultimately for the patients and the service users and the communities that we're there to provide care for, to help people to lead fulfilling lives. And it's also there for the people we lead in our teams and organizations. So that implies actually a very strong focus on performance and performance management, a much stronger focus than, as I say, the command and control approach. And by the way, the link with outcomes is not simply what I believe. There is a wealth of evidence from within the NHS and other organizations that when leaders collectively practice these behaviors, that predicts the outcomes we seek. But in relation to managing an individual's behavior, if you have someone who is behaving in an aggressive way or a discriminatory way or a bullying way, or somebody whose performance is failing patients consistently, then compassionate leadership is about focusing on those problems very clearly, transparently, ethically, in a mutually respectful, open, courageous and compassionate way. And that requires, and by the way, I should say the big problem in the NHS is not that people the problem is not that people in some sense are being compassionate. The problem is that people are failing to address performance problems and behavioural problems in a courageous way. And compassion, I think, is about being authentic and honest enough and courageous enough to address those. And that's about analysing, identifying what the problem is and analysing it and recognising that most behaviour is a result of the situation people find themselves in rather than personalities. And then analysing the problem and the context, identifying what the problem truly is, meeting with the person to discuss the problem in a mutually respectful, caring, compassionate way, attending, understanding, empathising and helping, and providing really clear feedback, because often we fail to provide clear feedback to people out of some fear of causing upset or pain. But as long as these things are done compassionately and we've created a supportive context in our teams and organisations, it's much easier to give that kind of feedback. And then it's about agreeing goals for behaviour or identifying solutions, mutually agreeing them together, and then monitoring and providing feedback and continuing to review. So compassionate leadership is about really addressing these problems in a clear, honest, open, supportive way in order that they can be worked through wherever possible.
So if I've heard you correctly there, Michael, compassionate leadership is not just good for the individuals that demonstrate it to others, because the others benefit personally, their teams will benefit, their patients and carers will benefit, but it's good for the person who is delivering that type of compassionate leadership personally. So many of the audience will be working in health and social care environments, and I'm sure they'll be listening to this, thinking and reflecting upon it for their own teams. But some of them may be thinking, Michael, that's good for a team who deals with patients or carers, or perhaps work in a nursing home, or perhaps work on a ward, or deliver psychotherapy. We get that, Michael. We get compassionate leadership now. We're following you. But some people might work in, for example, a finance team, a research team, which many of our colleagues do at UKRD, or an estates team, or in catering in the NHS or social care. How can compassionate leadership be applied to a non-clinical team?
Well, a work organisation is simply another form of human community. We have all sorts of forms of human community: social clubs, football clubs, religious organisations, voluntary organisations, work organisations. They're all a form of human community. And their cohesion, if you like, the glue that binds them together, is people feeling included, valued, respected, cared for. And so if we're to create cultures of high quality, compassionate care, then that requires all to model that core value or that core emotional regulation system of compassion, because culture is a consequence of the interactions of every one of us every day. How warm we are, how kind we are, how irritable we are, how cynical we are in our interactions, whether we're part of a clinical team or part of estates or finance or R&D. Every interaction by every one of us every day in our teams, in our organizations, across team boundaries, across departmental boundaries, shapes the culture, because the emotional ripples spread out. As I said, culture is like an ocean rather than separate pieces of pizza. And so every one of us has the opportunity to shape the culture of our organizations through our every interaction every day. And it's as important for people in those corporate functions that you describe to model supportive, compassionate behaviours, to listen, to understand, to empathise and help, as it is for any other individual within the organisation. And not only that, but when we create these kinds of cultures in health and social care, it ripples out into our wider society. I think there's no more important institution in our society than our NHS, because 1 in 20 people work within the NHS. If they come into work every day and encounter compassionate leadership and compassionate cultures, they take that back out into their families and communities, whichever department they work in. And if the 1 million people who use NHS services every 36 hours encounter compassionate care, they take that back out into their families and communities, spreading compassion throughout our society at a time when it desperately needs it. So I think it's the responsibility of each and every one of us to create the kind of cultures that enable us all to thrive and flourish in our lives.
I have to say, Michael, I've never heard that sort of image being described so well, of that ocean, where wherever you are in that ocean in health and social care, whatever function you provide, whatever level of care, or wherever your role is in that, whether you're in estates, catering, reception, one of the domestics, it's irrelevant in that sense, because all of you have the opportunity to establish an emotional ripple somewhere. And if you get enough emotional ripples, we create the movement that we need in that water, which affects the culture for everybody. And in effect also affects the culture of the entire country, because there are so many of us in health and social care in that ocean. I've never heard it described like that. So a new type of global warming has just been established there, but in a positive way. Thank you. So if people haven't got time to read more about compassionate leadership, and there's lots on the internet, as I said, your book's available, what simple steps could they take to ensure that compassionate leadership is part and parcel of what they do in everyday life?
Well, it's something that each of us has control of, Nav. We each have a choice in every interaction, whether to be present with the other, to listen, to seek to understand their situation, to empathise with them, and then to see if we can help. And that's a choice we all have. It's not about learning a new skill, because it's a natural part of who we are. It's not something we need to beat ourselves up about. Oh, I wasn't present with that person. It's being aware that we have the opportunity to be compassionate in our interactions with each other, first by being present with others and listening deeply, giving our attention. And that's something we can do in every interaction every day, whether in work or out of work. The there is, I would say, a broader social movement about developing compassion and compassionate leadership in the NHS. All 4 national bodies across the UK now have compassionate leadership at their core. In the People Plan for NHS England and Improvement, compassionate and collective and inclusive leadership is now central to that strategy. There are great examples of where compassionate leadership is being developed. Health Education and Improvement Wales has a 10-year strategy for developing compassionate leadership across the whole of health and social care. And on their website are lots of practical resources taken from the book that you can access there and use in developing your own leadership and the culture of your team. There are places like Berkshire Health, which has retrained more than half of all of its staff now in compassionate leadership, and lots of other examples around the country and links where you can get access to resources to help you develop this changing culture, or this changing ocean, if you like, Nav, to bring about the better organisations, teams, and indeed societies that we all desperately want in our health service and in our country as a whole.
Thank you. And we've described all of us as being part of that ocean. And health and social care is often described as a contact sport, where you in effect are relating to each other, you're relating to patients and carers, and then our wider community. But a lot of the NHS has been deeply affected by COVID, and I think a great transformation has occurred in terms of the way that we deliver care, the way that we engage in meetings, for example, virtually. And that has had a profound effect on many of my colleagues who felt sometimes alienated from their colleagues because of technology. Technology can help, but it can also hinder. How do we enable compassionate leadership when sometimes people don't meet their other colleagues for weeks or even months on end?
So we know that when people use these technologies to meet, that they are a relatively impoverished means of communication. We know also that in meetings that use these technologies, people are likely to become more agenda focused and more task focused, and to neglect social interactions. And I think what's important is that though we may develop these hybrid ways of working, a mix of these technologies and meeting face to face, we must make sure that we have sufficient face-to-face meetings, so we've got a basis of trust and understanding that enables us to manage the technology-mediated communication systems better. We've seen that there are some ways of compensating for the loss of more fine-grained human contact in face-to-face meetings by, for example, when we meet with these technologies, let's say it's a team meeting, that we restate what our vision is, what our inspiring purpose is as a team, that we embrace these new technologies and, take advantage of some of the benefits that they confer in terms of not having to travel, having a bit more time, and recognizing that what that gives us is also more time to do really important things like show our caring for each other. So in our team meeting, I may talk to one of my colleagues and say, well, Gillian, I know you've been under real pressure at the minute and you lost your father last week. So is there anything I can do to help? And I know it must be really difficult for you. So showing almost extra caring in a way, and also making sure that we take the time in meetings to say thank you to each other, to show gratitude, to show appreciation, to celebrate, because that's really hugely important for creating a sense of belonging, acknowledging people's contributions, making sure that we take the time to chat. How was your weekend? How was your daughter's birthday party? Some humour, maybe talking about, some Netflix series we've both or all of us have seen, and making sure that we're bringing everybody into the conversation, so including everybody in the team meeting. So, Jeff, what's your view about this? I know you've done some work in this area. and managing conflicts quickly and early in these meetings in a mutually respectful, supportive way. So it's about, in a way, knowing we know what's important in terms of building a sense of belonging, of feeling valued and respected and cared for. And it's about making sure we do even more to do those things during the course of having these technology-mediated meetings, because they're so important for building people's trust and motivation, and particularly, the theme of all we've been talking about, that sense of belonging, of feeling connected, of feeling valued and respected and cared for.
And it strikes me, Michael, that some people might think, well, that's artificial, doing all that sort of stuff over Teams. But the way you described it, in effect, was just a way of recreating what we would ordinarily do, but we forget to do that because of the technology, and therefore it's not artificial. The technology is the artificial bit, not the human interaction.
Absolutely. The technology is the artificial bit, because we again have been hardwired by evolution to pick up the nuances of slight changes in facial expression or body posture that enables us to communicate, to connect, to feel a sense of trust with each other. And when we lose that through the use of technologies in this artificial situation, we lose some of the richness and some of the sense of connection. And connection is just so deeply fundamental to what it is to be human. And so we must compensate by doing more of what's natural to overcome that artificiality.
Well, Michael, I'm afraid we've come to the end, sadly for me anyway, to the end of our conversation today. I'd just like to thank you on behalf of all of UKRD for that deep and yet short insight into compassion. And I think I've felt a little bit more of an understanding about not just what compassion means for the individual, but for teams, for patients, carers, and actually our entire country. I've seen the links between compassion and trying to sort some of the major human resource issues we have in the National Health Service and social care, and the fact that it's not soft, it's actually courageous to employ compassionate leadership techniques, especially as it actually delivers objective improvements in performance and productivity. And you've also, I think, neatly described this vision that we have of us being in an ocean, and that technology must not get in the way of what I would call the ordinary interactions of everyday life that are so essential for building up compassionate relationships and leadership. So for all those reasons and more, Michael, can I thank you on behalf of all of us for taking the time this morning. I'm sure there'll be lots of chat that goes on at the virtual summit as a result of that. So thank you very much indeed.